They are intelligent, successful, fun, always on the go, in shape. They enjoy benefits of their chosen career in all forms: financial, emotional, physical, and social. They are psychiatric technicians. Psychiatric technicians have a positive impact on people's lives, make a difference, inspire hope, feel needed, and have an impact on the world.
This is a field for a certain type of individual, a really caring person, a person who's fascinating by how people behave, what's behind why some people are troubled. And so it takes a compassionate person who is very interested in people and in how people cope with their day-to-day experiences.
Psychiatric technician is a type of person who knows a lot about many reasons for certain types of behavior, personality traits, motivations, and different abnormal patterns of perception and emotion applications, as well as understand and help those in need. Working with a professional services team, a licensed psychiatric technician deals with people who the society would rather not deal with, people who are considered to be developmentally or emotionally disabled. PTs are concerned with people of any age that suffer from mental distress or mental illness such as depression, psychosis, and dementia. Not only do PTs provide nursing care, they also provide holistic care as well as psychological, biological, and mental help. PT is not only the person who knows a lot in the field of psychology and psychiatry, but also in behavioral science, serving in both public and private civil service. Pharmacology is a required course by the state board. This subject matter helps the technician learn to understand and safely administer medications. They learn the dosages, drug standards, sources used to treat developmental disabilities, childhood psychiatric disorders, and a diverse number of other mental disorders. The best thing about the PT is the product of your work. You may see results right away. You may see your patients change, get rehabilitated, discharged, and reach their maximum potential. PTs will be able to help patients to not only exist, but to also live fully and happily. They will become a family member to them. And this exchange is mutual, because it also satisfies your soul needs and balances your emotional world.
Well, I chose Psychiatric Technician program because I really like to work with people. I really want to make a difference with people that some people think they already cannot make that difference, but I know they can if all they need is just your help.
Starting from the middle of the 20th century, the state of California began to recognize and appreciate the importance of behavioral nursing profession by fully certifying PTs. A psychiatric technician receives exclusive and unique type of education to provide the highest level of service for mentally and developmentally disabled people. Such technicians learn both theory and hands-on applications in clinical settings, who will be able to understand flexibility. The basic genetic principles covered are etiologies, mental retardation, chromosomal mutations, symptom picture, detecting developmental disabilities, prevalence, and child psychiatric disturbances. PTs work in public and private sector, senior communities, and Alzheimer's centers. Locked hospital units in correctional departments are an example. They also provide state service and are able to receive challenging careers with solid health and retirement benefits, competitive salaries, and always possibilities for promotional prospects, union representation, and much more.
The psychiatric technician is a unique field. It's a licensed position that has a lot of credibility in the healthcare field. The psych tech essentially does much of what a registered nurse does.
People might be scared to go into the psychiatric technician program, but it's not what you really think. They don't just put you there with the patient. You get the strong foundation of all the nursing skills. You go through anatomy, you go through nutrition, you go through fundamentals of nursing. So by the time you start doing your clinicals, you're going to have a really strong foundation of all the nursing skills that you need.
We all work as part of a multidisciplinary team. There's, in this case, would be a doctor or a psychiatrist, psychologists, social workers, registered nurses, LVN, licensed vocational nurses, and psych techs. Not necessarily in that order or that hierarchy. Everyone has their unique role. And for the psych tech, I find that what I try to encourage them to realize is they're the ones who are spending 8 hours a day directly with the clients. They're the ones with the information that the other professionals need in their bigger planning. So we work holistically, and the psych tech is essential to the information gathering.
Common work activities of our psychiatric technicians include assisting and supporting patient treatment plans developed by psychiatrists, consulting and counseling with patients regarding the various medication therapies and treatment options, including behavioral interventions, counseling, and group or individual therapy, monitoring patients using medication and record keeping in accordance with medical requirements, researching and keeping up to date on new medications and injections, on dosage requirements and safety issues with the medications used, reporting any issues, concerns, or problems with medication or changes in patient mental or physical health.
I think one of the reasons that students are so attracted to this field right now is because it's very obvious that there's work out there as soon as you graduate. Even before you get your license, you can work as a psych tech aide or assistant, various titles, pre-licensing. But the facilities are very anxious to hire right now. And from what I understand, the salaries are very competitive and the benefits are wonderful.
If you want to understand the world and the everyday life, be useful and needed, do good and feel good, then the field of psychiatry is for you. For, as the famous American philosopher and psychologist William James once said, to study the abnormal is the best way of understanding the normal. To find out more information and data on vocational nursing and psychiatric technicians, To find out more about psychiatric technicians, visit California Association of Psychiatric Technicians. To find out more about the Psychiatric Technician program offered at Gurnick Academy of Medical Arts, visit